Okay, so today, thank you everyone for coming in. My name is Cassandra Taylor from Top Flight Defense Incorporated. And today we are on the line with Dr. Melissa Tracy from Rush University Medical Center. And she is going to be talking with us about a healthy heart. So, Dr. Tracy, you now have control as a co-host and you
Okay,
can introduce yourself and share your slide.
so I'm sharing my slides with you. Cassandra, let me know if you see them okay.
Yes, ma'am.
All right, everybody, welcome. I'm Melissa Tracy. I'm a cardiologist at Rush University Medical Center. I am an associate professor of medicine, and my areas of specialty are women and heart disease, primary and secondary prevention of heart disease, cardiac rehabilitation, echocardiography. I'm also the mom of three beautiful children. I don't know where the time has gone. My oldest is Isabella, and she's going to be 21 this May. My middle child, Tristan, is going to be 17 next week, a week from today. And then my youngest is Quinn. So I really welcome the opportunity. I think I've been doing this now with you, Cassandra, for 4 years. It's become our tradition for February Heart Month.
Yes, it's been actually 3 years. Yes,
Great.
ma'am.
Well, we're just going to make it for next year. Uh,
There you go.
so today I'm going to talk about keeping us heart healthy. What can we do now to reduce our risk of heart problems later in life? And there's a lot that we can do, ladies. There are modifiable risk factors. The non-modifiable risk factors are that we're all maturing in age and our family history. Can't change that. That's what we're delivered. But the modifiable risk factors include smoking, high blood pressure, obesity, cholesterol, high cholesterol, sugar diabetes, stress management, stress, anxiety, depression, of which we all have to one multitude or another, and sedentary lifestyle. There are, though, some scary statistics I want to share with you. Over 35% of the American adults are obese, and this is with a BMI greater than 30. 8.3, at least 8.3% of American adults have diabetes. 38% are pre-diabetic. Greater than 30% of Americans are inactive, and that means not meeting the guidelines, which is of 150 minutes of moderate intense activity per week. 50% of adult Americans do not meet those guidelines. And 33% of adult Americans have high blood pressure. And specifically in high blood pressure, African American patients do lead the way here. And so we have a lot of areas in our modifiable risk factors where we can make an impact and make a positive difference. 1 in 3 adult women have some form of cardiovascular disease. And this is really important to know because for the longest time, we thought that heart disease was a disease of men. But that was because women have protective estrogen. Once our protective estrogen is gone for greater than 10 years, and this could be due to surgical or menopause, we begin to have the risk of a man. But what makes this more difficult and challenging is that there are still healthcare providers who believe that heart disease cannot affect women. There are a lot of women who believe that heart disease cannot affect them. Women and men have very similar cardiovascular risk factors. However, women have some sex-specific risk factors which men don't. And those are disorders of pregnancy, specifically being preeclamptic or eclamptic. That's where you have high blood pressure during or after pregnancy, adverse outcomes of pregnancy, and menopause. So there are specific risk factors that primarily or solely will include women, and those are the ones related to pregnancy and menopause. The manifestations of heart disease, though, can be different in men versus women. Men are more likely to have what we call occlusive coronary artery disease. And that's where there's an increasing plaque buildup in a coronary artery. Women are more likely to have non-obstructive disease or microvascular disease. And what does that mean? Well, the coronary arteries are like the oceans, big, big bodies of water. Well, big bodies of water break down into smaller bodies of water, lakes, rivers, streams, and ponds. So women can have one non-obstructive coronary disease where their vessels are small or where they don't react appropriately, meaning they constrict where they are supposed to dilate. Microvascular dysfunction is where those little vessels, those ponds and those streams, because there's a lot of them, those start to react poorly, or those get built up in atherosclerosis versus the large vessels. And those are very, very challenging ways. There's difficult ways of being able to decipher if it's microvascular disease. Because what will initially happen is a woman will come in with symptoms that are suggestive of coronary artery disease, or she'll come in with what is called elevated troponins, which are suggestive to be consistent with a heart attack, but she does a cardiac catheterization, and those big bodies of water, those big main vessels, they're open. This wasn't coronary disease, but yet it was. But it was of those smaller vessels, or it was due to microvascular dysfunction where the vessels close rather than open. Men tend to develop coronary artery disease earlier in life than women, and this is because of our protective estrogen. But again, as we become postmenopausal, our risk, and typically that's about 10 years after we've lost our hormones, that we start to reach the risk of a man. And there's a higher prevalence, again, of that typical coronary plaque rupture for men with acute coronary syndrome. But there's a less prevalence of that with women. And women are more likely to have something called spontaneous coronary artery dissection, where a vessel can actually dissect. And that's actually also can be hormonally driven. And finally, women tend to have less typical symptoms than a man. So the typical symptoms are that heaviness, that weight on your chest, feels like an elephant is sitting on my chest, associated with shortness of breath, sweating. Women may get more jaw pain. They may get more arm pain. They may have more symptoms of shortness of breath or more fatigue. So it's really important that we look to see if there's a pattern, because regardless of the symptoms that a man or a woman will have typically, and I'm using that word typically, begin with exertion. And then they begin with less exertion. And then they can start to occur at rest. Or if it's a sense of less fatigue, women find that they just cannot do as much as they used to do. It's typically, again, typically a gradual process. So what are ways that we can use medications if need be for those modifiable risk factors? So one of those areas is statins, cholesterol lowering medications. But it's confusing. Who needs it? Who shouldn't be on it? The patients who shouldn't be on it are women who are trying to get pregnant or who are pregnant, or who have myopathies, disorders of their muscles, which makes it difficult to know whether or not it's the cholesterol medicine that is affecting their muscles or their myopathy. And then those who have liver disease. There are some liver diseases, specifically fatty liver. Fatty liver is also known as non-alcoholic cirrhosis. And that's just because our diet is so embedded with fats that we overload our system with fats. So it's called fatty liver, and fatty liver can lead to non-alcoholic cirrhosis, which will or is becoming the #1 reason for liver failure in this country. In that case, those patients can actually benefit from a statin. But who are those patients who definitely can benefit from a statin? And those are patients who have already had a cardiovascular event or a cerebrovascular event, a heart attack or a stroke. Those are patients who need it because they've already had that event. And this is for secondary prevention. Those patients who also have familial hypercholesterolemia or LDL. LDLs are bad cholesterol, of greater than 160, 190, pushing it. But typically 160, we should really be looking at starting a cholesterol lowering medication like a statin. And then also those for primary prevention who are at high risk. So our more mature patients or patients who have multiple cardiovascular risk factors, or when we do their cardiovascular risk on one of our calculators, has a risk greater than 7 to 9%. Some of those cardiovascular risks, again, are sex specific to women. So women who have gone through early menopause or women who have had complications due to pregnancy, they may actually be in those higher risk categories. What about the patients who shouldn't? I pretty much went over that. And those are the younger, low risk patients and those who are trying to get pregnant, those patients who have high cholesterol but may have a myopathy, and those patients we have alternative drugs for. And then the maybes are those patients who are 40 to 75 years old and whose risk on the risk calculator is borderline or again, shared decision making. I actually have one of my younger patients. She's only in her early 20s. She's in high school, in college, and she plays soccer. So she's really active. So she plays soccer competitively for her school. But she has a really high LDL, the bad cholesterol. She's still regularly getting her period, but her mom, who's only in her 40s, is already on a statin for similar reasons, high cholesterol. But her uncle, her mom's brother, had a stroke at a young age. Shared decision making with the patient because she's of age where I have that straightforward discussion with her. But then we brought mom and her uncle in on the discussion, and the four of us accumulatively decided that a statin was the right choice for her. So shared decision making is really, really important. And you should feel empowered to speak with your physician about these things.
Dr.
What about,
Tracy,
yes.
I have a question here on Facebook. Someone wanted to know about heart murmurs and irregular heartbeat.
So if it's okay, if we could address that question later, because I
Sure.
will have more time. Those heart murmur and irregular heartbeats depends specifically on what the murmur is from and what kind of irregular heart rhythm. But we can absolutely expand on that. Aspirin, reason for aspirin, again, is yes, no, and maybe. So there was a very large retrospective study done about 5, 6 years ago, looking at which patients specifically would benefit from an aspirin. And the reason that was really important is because we used to knee jerk it. Once a man turned 45 and a woman turned 55, we started them on aspirin. What this large retrospective study showed to us that we have to look at the risk versus benefit ratio because we know that there is increased risk of bleeding and of gastrointestinal adverse effects with aspirin. So they looked and they said the patients who should definitely be on an aspirin are actually those that are similar to a statin. If they've already had a heart attack or they've already had a stroke, those patients should be on an aspirin. Again, if they have a high bleeding risk or have had significant gastrointestinal side effects from the aspirin, we may need to think of alternative options. But secondary prevention, primary prevention for healthy men and women 40 to 70, 75 years of age, we don't start them on aspirin. Again, because of the fact that we know that there's an increased risk of bleeding and gastrointestinal side effects with aspirin. And those maybes are very similar. Those who have risk factors for heart disease, coronary calcium score, which is a great screening tool. It's possibly not covered by insurance, but many institutions, including Rush, offer a coronary artery screening calcium score for a nominal fee, but it gives us really, really good information. And what does that information tell us? It tells us if any cholesterol has already laid down in our coronaries and calcified. Because once that's calcified, we cannot get rid of it. So coronary calcium score that is elevated, or if it's not possible for multiple reasons to get their other modifiable risk factors, specifically lipids and blood pressure under control. This is coupled, though, with those patients who have a low risk of bleeding. So there are various calculators that you can use to calculate your risk of heart disease. These are just two examples of the types of data that we have to import for them. One is gender, female versus male, age, race, total cholesterol, HDL cholesterol, which is the protective cholesterol, also the blood pressure, and whether or not they're a smoker, if they're already taking a cholesterol lowering medication, are they taking medication for blood pressure, and if they are taking medication for diabetes. So all of this is included. And again, that risk comes back to what is the 10-year cardiovascular risk of this patient developing coronary artery disease? Score less than 7 is a low risk. 7 to 9 is that moderate risk where we should take into consideration family history. There's more sex-specific risk factors such as early menopause or complications with pregnancy, and again, shared decision-making. Once you start getting into the double digits of your risk for developing coronary artery disease, a statin is probably the right place to go. And you should discuss with your provider the risks versus benefits, the potential side effects. So I just had a patient the other day. He didn't start his statin. And I said to him, I said, I don't think you started your statin. He goes, yes, but the risk of developing dementia. I said, okay, fair. I said, there isn't a strong correlation between statins and developing dementia. There's been some prelude that may be, but it's not strongly tied. I said, let me turn this around and say, what about the risk of having a heart attack? And he looked at me, he goes, not so good. I go, not so good. So you do have to discuss with your healthcare provider because there are risks, but those risks, when you do the risk versus benefit ratio and you look at the benefit of statin to prevent a secondary heart attack, to prevent a first heart attack, or to prevent a subsequent stroke, the risk versus benefit ratio tends to be in favor of a statin. So we can do this. One of these two pictures we shouldn't be doing, and that would be the guy sleeping on his sofa with a remote on his protruding abdomen. And that would be somebody who has risk adverse desire to exercise. And then we have the family. And what's nice about the family is they're doing it together. So exercising with somebody is awesome. And look at those smiles on their faces. They're thrilled to be exercising. But what form of exercise should we be doing? I am at conferences all the time. So I'm at cardiology conferences where there's an escalator and there are stairs. And I have to tell you, the backup for the escalator is very similar to this. And I laugh inside. I think, first of all, we're at a cardiology conference. Second of all, we should be including this in our moderate, intense minutes of exercise per week. So one easy way to exercise is do stairs regularly. When you're at work, when you're going to an appointment, use the stairs. Walking in a mall, don't use the escalator, use the stairs. When you're going to a grocery store or to run any errands, park farther out in the parking lot and walk to the beginning of the store. So those are ways of easily incorporating exercise or movement into our regular day in and day out activities. Dancing. I love to dance. My kids love to dance. So when we're cleaning up after a meal, we have music on, all different genres of music, and we are dancing. You can dance alone, which you can be as goofy as you want. You can dance with somebody. And the other nice thing about dancing with somebody, especially if you bring them in close proximity to you, that closeness not only is getting you to move with exercise, so increasing your heart rate, but the endorphins and the peace hormones of enveloping somebody into your private space. It really does not only our soul and our heart, but it does our mind a world of goodness. And it doesn't matter if you're a man or a woman. We should all be exercising. And we should also be an example to the youth in society. Our youth, I felt like, and the data had our youth were doing more, they were taking better care of themselves, they were smoking less. Well, since they began to get jeopardized by the tobacco companies, and now the tobacco companies are luring our youth to vape nicotine, vape oils with flavor, our youth are becoming at greater risk of developing heart disease, cerebrovascular brain disease, but we also don't know what this is doing for brain development, what it's doing to our lungs. So we need to be an example to our youth of not smoking, not vaping, and exercise. And it doesn't matter what age. Our youth should be exercising. We have an epidemic of obesity in adults. We have an epidemic of obesity in our youth. And our young ladies are getting their menstrual cycles earlier because of obesity and because of all the hormones that are in our food now. So we need to get our young people exercising with us or with their friends, getting out and playing ball, kicking a ball. I remember when I was younger, we were out all the time. Your mom used to tell you, come back when the lights go on outside. And the lights would go on and you're still a mile from home because you were playing with your friends. We need to get our youth out of social media, off their phone and off of gaming, and get them outside where it's fresh air, where they're engaging in social activities face to face. And we need to be exercising. And again, exercise at any age, even as we mature in age, there is still such a benefit because as we mature in age, we lose skeletal muscle. We have more problems with falling, more problems with balance. Exercise can help all of those areas. So how do we exercise? Again, finding a family member or friend to help motivate us or exercise with us is great. Look at these ladies just out in the street exercising together. This is an awesome picture. Ideally, exercising 3 to 5 times per week, 30 to 60 minutes. But if you can't do it at a focused 30 minutes, 3 to 5 times per week, do it as often as you can, but then incorporate those stairs or incorporate walking from farther out in the parking lot to the front of a store. And do whatever you can with dancing and getting around. And vary the intensity. Our bodies like when we spice it up, just like we don't want to eat the same meal day in and day out. Our body gets bored if we do the same activity. So spice up your activity. Don't get overwhelmed. Make it fun and make it gradual, but make it last. And I like to equate exercising with showering. So if I don't shower, I feel pretty scuzzy. If I don't exercise, I feel scuzzy. So think of it that way. Figure out how to make it not something that you repel against, but something that you embrace. And weight training is really important for men or women. Ladies, we're not going to look like Arnold Schwarzenegger. We don't have enough testosterone to look like Arnold Schwarzenegger. But there is a real importance, I would say 3-point importance to muscle mass. One, it protects our bones. So if we fall or we get injured, our bones are more protected by greater muscle mass. Two, it makes us a more efficient machine. So the calories we take in, we burn those more effectively. And three, muscles are sexy. You look at yourself in the mirror and you go, I like those muscles, because you like what you see. And finally, exercise is a gift you give yourself. Nobody can do that for you. So think of it as your reward, your gift that you're giving yourself. So there's different forms of exercising. Traditionally, jogging or brisk walking are historically the ways that we go about our exercise because they're easy. You put on a pair of shoes, you walk. But there's other forms of exercise. Cycling, whether it's a stationary bike or when the weather permits, you get out on your bicycle. Swimming is a magnificent form of exercise because it doesn't have impact on our bones and our joints. It also is one of the best aerobic exercises because you're breathing and you have to hold your breath, or just the intensity of pushing the water away, really is an amazing form of exercise. Dancing, as I talked about earlier, yoga and mindfulness and stretching, if you can find the time to incorporate those forms of exercise, because not only are they a form of exercise, but they're also really good for our mind and mindfulness and peace and serenity. And again, make it fun, make it comfortable, make it gradual, but make it last. Engaging in sex is important. And in this sense, sex actually burns more calories, 5 calories per minute. It increases heart rate, uses various muscles. It stabilizes our hormones. It improves our sleep. And just like with dancing, when you bring somebody into your personal space, it will result in soothing of anxiety and peace. So it also, intimacy boosts our self-esteem and our happiness. There's known data that by incorporating exercise into our lifestyle, we have a 20 to 30% reduction in death. Tell me a medication that can state this right off the bat. So if we incorporate this into our lifestyle, no medicine, holistically doing something to improve our cardiovascular risk and our lifespan, exercise. We do have to look at what occupation patients have, or what recreational capacity, because there are patients who have really high intense jobs where they're really moving a lot during their job. That's part of their moderate intense movement per week. What forms of recreation do they have access to? And so use those forms of recreational activities that they have to incorporate. Don't suggest that they swim if they don't have access to a swimming pool or they don't know how to swim. So we should be speaking, we meaning healthcare providers, need to be speaking with our patients about what recreational activities they like and what they have access to. And even weekend warriors are important. So if it's only the weekend, that you can incorporate exercise, use your weekend and do it regularly. And then, like I said, we have to look at the readiness of that patient and any barriers to getting them to start exercising, and work with them so that we can encourage them to exercise. So this is really good, ladies. Everybody should calculate what their zone is. So if everybody just writes down this equation, it's 220 minus your age times 0.75. And this is a nice way for you to gauge where you should be working your heart rate to when you are exercising. If you want to work a little bit more intense, you can do 220 minus age times 0.8. That would be 80%. The reason for this 75 to 80% is that that's typically in your aerobic zone. The reason why that's important is that's where we improve our cardiovascular risk. Once we start going beyond the aerobic zone and more into this anaerobic zone, 80, 90%, we're still doing a great job, but our risk reduction really plateaus. And that's where also novice exercisers can injure themselves. So for athletes or people who are training for an event, they may need to work into that anaerobic zone. But for the lay person, the person who is looking to improve their cardiovascular risk, that's 70, 75, 80%, that's all you have to do. And then you sustain it. So you do a warm up for a good 3 to 5 minutes. It's where you're gradually getting your muscles warm. You can still talk, you're not sweating, but you're feeling your muscles are warming up. Your joints are warming up. Then you get to that zone here, zone for 70, 75, 80%, and you sustain that for 10, 15, 20, 25 minutes, whatever it is that you can do. And then don't forget to have your cool down for, again, another 3 to 5 minutes. So weight management. This is a big problem. This was projected data for 2020. We are now in 2024. USA, that's the red color, is leading the way for overweight and obesity in the world. This is not something that we as Americans should be proud of. This is something that we have to get under control. So obesity in this country is an epidemic. We have to get this under control for men and women. And again, also for our youth, because our youth are becoming more overweight at a younger age. So if you look at the left side of the screen, we look at a burger and then a triple burger and so forth and so on. This equates to also, if you look traditionally at the plate size, our dinner plate size has also gotten larger. And what happens is that we feel that we have to fill that plate, and then we feel that we have to finish that plate, because we all have our mothers or our grandmothers who said, finish your plate, clean your plate. Well, that was what our grandmothers and our mothers thought that they should be telling us to do, until we started putting on the weight. And then it was like, they'd look at us, what's happening to you? You look like you're putting on some weight. Oh, okay, I don't want to finish everything on my plate. So ladies, don't feel obligated that you had to finish everything on your plate. Or if you go to a buffet, take a little snippet of this, snippet of that. If you don't like it, don't eat it. But you can see on the right hand of the screen, as our portion sizes have increased and our plate sizes have increased, look at the exponential linear increase of obesity in this country. It is startling. And the American Heart Association has actually, in their scientific statement on exercise, that exercise can be viewed as a preventive medical treatment, like a pill that should be taken on an almost daily basis. So there's a lot of patients who are pill adverse. I don't want to take medicine. Okay, let's go the holistic approach. Let's get you to exercise. Let's get you to eat healthier, and let's get you to lose some weight. So the benefits of exercise: it reduces the risk for health problems. Depression, anxiety, and cognitive impairments are also improved with exercise. It improves our risk of cardiovascular disease, stroke, diabetes, and death. Lowers blood pressure, increases our metabolism, improves our cholesterol, improves our circulation. In fact, exercise is number one of what patients should be doing if they have peripheral arterial disease of their lower extremities. It strengthens our heart function, and it is critical for stress management. Talking about stress management, we all have stress. There's no way to get around it. If we're living, we're going to have stress. So the first thing I want to do is let's get rid of perfectionism. Nobody's perfect, and nobody has the white picket fence outside their house. So I like to go on this mantra, do it badly. What does that mean? Just go into anything you're doing and say, I'm going to do this. I may do it badly, but what you're going to find out more often than not, you're not doing it badly. You're actually doing it quite well. But if you don't take that risk, if you don't take the initiative, if you don't liberate yourself to do activities, you're never going to give yourself the chances to find out how good you can do. So do it badly, and then prove to yourself how not badly you're actually doing it. This speeds up our decision making, and it catapults us into action. And I love thinking about it. Doing it badly often means not doing it badly at all, and liberating us from restricting ourselves. Learn to compromise. It is so important that if in a dispute or in a meeting or in a disagreement, find some common ground. In today's world, there are so many people not finding common ground. We are all part of the United States of America. There are red parties, there are blue parties, but all the parties are about the US, about us. And the more common ground we can find, the better all of us will be. There's this great country song called Mama's House. And if every house had a front porch, if every front porch had a swing, if every backyard had a swing set, if every family had a mama, then maybe we'd be a little bit less adverse to each other. And I'm big into country music, but I love all genres of music. And then sleep hygiene is really, really important. We're actually looking at sleep as another vital sign, because when we don't sleep well, our heart rate can be higher, our blood pressure can be higher. Those are going to both put increasing stresses on our brain and on our heart. And everything seems to be a little bit more weighted on us. If you have a risk for obstructive sleep apnea, where you actually periods of time in the night that you are not breathing properly, obstructive sleep apnea actually increases cardiovascular risk. So if your partner tells you that you're snoring, or you're waking yourself up snoring, or you're not well rested in the morning, or if you find the need to have to take naps, speak with your healthcare provider if you need to have a sleep study, because it's the classic picture of a person with, no neck, or a fatty neck, or the typical big football player of having obstructive sleep apnea. That's not necessarily the picture of those who have obstructive sleep apnea. So if you have an increased risk, or you snore, or you're not getting restful sleep, please speak with your healthcare provider. So starting every day with a positive attitude, starting every day, make your bed in the morning. It's a great way to start your day. You have now you've accomplished something. When you start out your day with a positive attitude, start out with making your bed, you're setting out your day with the right foot. In our house, we have a mantra: all days are good days. Some are just better than others. And we live by that mantra. Wait to worry, postpone worry. Of course, you may get a flat tire. Of course, you may get called into your boss's office, or you may get called from your children's school. Excuse me for 1 second. Those are all possibilities, but they may not happen. So postpone worrying and set aside each day for time of reflection about your day. What went well? What went less well? Not what went bad, but what went less well. And also help others. Coming on during Heart Month and doing this with Cassandra and all of you, I enjoy doing this. I give back something to the community about what I love to do. And I was walking with one of my coworkers. She works at the front desk at our office, and she goes, "Dr. Tracy, how do you do this? I mean, your hours, all that you have to sacrifice." And I said, "I know that almost every single day I will have a positive impact on even just one patient every day. Because if I average it out, or I'm on call, I'm having a positive impact on at least one person every day. So give back to others, and it'll make you feel really, really good." And what COVID did, if we want to say did, because COVID's not going anywhere, but it has transformed all of us. We're all in a new way, a new norm, and we have to embrace that this is our new norm. If we keep thinking about how things used to be, we're going to drag ourselves down. We're going to give ourselves into a negative position. We're not going back to pre-COVID. Just like we have to take a vaccine or recommended vaccine for flu, COVID, I think, is unfortunately here to stay. But focus on what is the same. There's a lot that is the same. But make space for new things, because new is always good. It explores our options. It provides for growth. Make sure you're managing your anxiety, taking deep breaths, closing your eyes and focusing on your breathing. There's something really easy that every one of us on this virtual call can do. And I do this myself, and you could do it. You could do this sitting at your desk, sitting in your car, going into the bathroom. You put your right hand on your heart. I'm going to just show you. And your left hand on your abdomen. And I like to sit in a comfy chair. And I relax my heart, and relax my shoulders. And I'm going to put and I close my eyes. And I take a deep breath in. And I blow out. And the purpose of having your heart on your hand on your heart is you can feel your heart beating. And the purpose of having your hand on your abdomen is you can feel the rise and the fall of your abdomen. And every one of those exhales, you're just blowing out the stress. And you can just do this for 30 seconds, 45 seconds, a minute, and just go escape. And you will just feel this sense of relaxation. And you can't do this too much, but try that. If you're having one of those days and you just need to dispel some of that stress or that anxiety, just do that. I can tell you, every time I do it, I just feel like the stress is just pouring out of every one of those breaths. And deal with grief in a healthy way. There are things that we are all going to miss out on, but there's going to be so many things that you can take advantage of. So grief is normal. Grief during COVID, grief with things that have happened in our lives, but deal with it in a healthy manner. There are ways to definitely set progress and set goals. Make sure that you're setting goals for yourself. That's really, really important because you'll feel more accomplished. And when you feel accomplished, you can stand up stronger. You feel that you are in the room. And it is important to make sure that you feel important and that you feel that you have a place to speak and to be heard. So key messages I want you to take away from today's lecture is heart disease is the #1 killer of women and men. But heart disease is preventable. Knowing your personal risk is the first powerful life-saving step to a healthy life. Love your heart. We only have one of them. Take good care of your heart. Improve your lifestyle to include exercise, healthy eating habits, and no smoking. You have dealt with so much and done the best that you can. Take a moment now to appreciate how strong you are. Thank you, everybody.
Oh, Dr. Tracy, thank you so much. I mean, I truly enjoy when you come on and do these classes with us because your energy, your flow, your tone is so soothing. Um, it's energetic, but yet it's soothing because this is what we need. And I truly appreciate that. I'm looking to see were there any questions. The only one was the individual that talked about the heartbeat and the heart murmur.
So
And that's all
there's
he said was, what about it?
So those don't necessarily correlate with coronary artery disease. They can correlate with developing what is called a cardiomyopathy, which is how well or not well the heart muscle is pumping. And by that, I mean that if you have mitral valve regurgitation, that's leaking of your mitral valve due to mitral valve prolapse, or if you had endocarditis, which is an infection of the heart muscle, that's going to overload the left ventricle. Or if you have narrowing of your aortic valve, that's going to put increased pressure on the heart. So those are reasons for having heart murmurs on the left-sided heart valves. In irregular heart rhythm, extra beats, PVCs. We used to think that PVCs, premature ventricular couplets, were benign. We now know that if we have too many of those, the heart muscle can get really upset about having too many of those, and it can become weak. But also there's arrhythmias called supraventricular tachycardias, atrial fibrillation. We can develop rhythm, fast tachycardic rhythm-induced cardiomyopathies. So they don't accelerate coronary artery disease. so disease of the coronaries, but they can affect the heart muscle. And in addition, atrial fibrillation, which is an irregular heart rhythm, which is the most common arrhythmia to occur as we get older, can be a risk for stroke. Because when our hearts are in atrial fibrillation, the top parts of our heart, the atria, they're just quivering, and blood can start to form blood clots. And if a blood clot forms, those pieces can break off and they can go to our brain. So in that respect, that can have a increased risk for a stroke. But for coronary artery disease, those tend to be different forms of heart disease.
Okay, well, thank you for the education.
My
Um,
pleasure.
and with that being said, I am going to thank everyone on Facebook with the heart, thanking them for chiming in and asking to continue to follow Facebook, continue to follow Top Flight on Facebook, Twitter, Instagram, and go on over to YouTube and Google Top Flight Defense Incorporated. You will see all of the classes that we have done, and you will see a familiar face over the last 3 years, and it's Dr. Tracy, always coming on doing a healthy heart. So with that being said, I'm gonna stop Facebook, say goodbye to them, but we're going to come back again. So go to our newsletter, sign up for our newsletter at www.topflightdefenseinc.org.